Dear medicos, welcome to my YouTube channel, Indian Anatomist. Hope all are doing well. Today, I am going to discuss the suprascapular nerve formation, course, branches, and its clinical anatomy. Suprascapular nerve is a mixed nerve that arises from the lateral border of the upper trunk of the brachial plexus, whose root value is C5 and C6. Please see the illustration of brachial plexus given. The dotted lines representing the nerve fibers, coming from the C5 and C6 of the upper trunk of brachial plexus. The suprascapular nerve plays a key role in the motor and sensory innervation of the shoulder region, specifically the supraspinatus and infraspinatus muscles, coming to the course of the suprascapular nerve. After emerging from the upper trunk of brachial plexus, the suprascapular nerve passes backward and downward through the posterior triangle of the neck, but above the clavicle. The green color area in the illustration represents the posterior triangle. The brown-colored structure is omohyoid muscle. Then, it travels deep and inferior to the inferior belly of omohyoid muscle and disappears beneath the anterior border of the trapezius muscle. For your convenience, the illustration shows the lateral view of neck and scapular region. Please see the descent of suprascapular nerve from the upper trunk of brachial plexus. From here, the suprascapular nerve enters the supraspinous fossa of scapula by passing through the suprascapular foramen. Before continuing the course of suprascapular nerve, let me tell you about the suprascapular foramen. What is suprascapular foramen? There is a shallow or deep notch present on superior border of scapula, just medial to the root of coracoid process. In living individuals and cadavers, this notch is converted into suprascapular foramen by the suprascapular ligament. Through this foramen, the suprascapular nerve passes through, whereas the suprascapular vessels pass above this ligament. Now, I'm coming back to the course of suprascapular nerve. In the supraspinous fossa, suprascapular nerve gives two branches. One, motor branch to supraspinatus muscle, and one sensory branch to the acromioclavicular joint. Then, it continues by winding around the spinoglenoid notch, enters the infraspinous fossa through the spinoglenoid canal, which is a small canal formed by the spinoglenoid notch and spinoglenoid ligament. Please see the illustration for understanding. Eventually the nerve runs slight lateral course and reaches the spinoglenoid notch, where it supplies sensory fibers to the glenohumeral, or shoulder joint. Now, the remaining nerve fibers travel medially to innervate the infraspinatus muscle located in the infraspinous fossa. Dear medicos, the course of the suprascapular nerve is completed. Next is branches arising from the suprascapular nerve. It gives two motor branches to supraspinatus and infraspinatus muscles. In addition to motor branches, it also gives two sensory branches to acromioclavicular joint and shoulder joint. Now, what actions are initiated by the suprascapular nerve? The supraspinatus muscle initiates and assists the deltoid muscle in abduction of arm from 1 to 15 degrees and acts with rotator cuff muscles. The infraspinatus muscle is responsible for the lateral rotation of the shoulder joint, associated with posterior fibers of deltoid and teres minor muscles. Both supraspinatus and infraspinatus muscles are part of rotator cuff muscles of the shoulder joint. I will talk about the rotator or musculotendinous cuff in the next video. Now, the formation, course, branches, and distribution of suprascapular nerve is completed. What next is left out? Yes, the clinical anatomy of the suprascapular nerve. Suprascapular nerve compression occurs when an anatomical structure produces direct pressure on the nerve. Refer to the illustration. The anatomical structure depicted is the suprascapular ligament. This ligament may become either thicker or ossified, permanently converting the suprascapular notch into a small bony aperture. Because of this, the injury of the suprascapular nerve results weakness in shoulder joint abduction and lateral rotation. This results from the paralysis of the supraspinatus and infraspinatus muscles. Dear medical professionals, please refer to the images provided on the right side. These illustrate the normal functioning of the supraspinatus and infraspinatus muscles. In the absence of nerve supply, these typical functions are lost. This is often seen in overhead athletes such as volleyball or baseball players, or in individuals with repetitive shoulder movements. Next is suprascapular neuropathy. This is result from trauma, repetitive stress, or compression of cysts near the glenohumeral or shoulder joint. See the illustration. This cyst is called paralabrum cyst. Next is diagnostic tests for suprascapular nerve lesions. Number 1 is physical examination. Loss of abduction and lateral rotation of shoulder joint. 2 is electromyography or nerve conduction study, is used to evaluate the suprascapular nerve function. Finally, number 3 is MRI, or ultrasound, is used to visualize the nerve entrapment or presence of cysts that compresses the muscles supplied by suprascapular nerve. Coming to the surgical relevance. During shoulder surgeries like rotator cuff repair, awareness of the nerve's course is crucial to avoid iatrogenic injury. Dear medicos, hope you all understand the suprascapular nerve. We will meet once again in another video. Please like my channel, comment, share, and subscribe.
Good day, all.